if you're on a Medicare supplement, you probably notice that your rates go up. I warn everybody, they're going to go up 5 to 10% a year every year, whether you use it or not. So after a couple years, you're like, hey, since this is not going to stop, can I switch plans? So yes, you could always switch to private Medicare Advantage plans during that end of the year window from October 15th through December 7th. But if you don't want Medicare Advantage, you want another Medicare supplement, you like Medicare supplements, you can go to any doctor, any hospital, no network, you like that, but you want one cheaper. You need some help on the prices. You may be in luck if you live in a state that has what we call the birthday rule. And I wish it was easy, but it is not. It is different. In every state that has a birthday rule, it's going to be different. So let's start off with Oregon. Oregon gives you a 31-day window beginning on your birthday. Oregon and California were the first birthday state rules, and it slowly spreading across the country. California gives you a 91-day window. It starts 30 days before your birthday and ends 61 days after your birthday. So if you live in Oregon and California and if you're healthy, you can change it any time of year, okay? But you're not healthy. Let's say you have rheumatoid arthritis. Nobody's going to take you. The only way you're going to be able to change to another Medicare supplement plan is you're going to have to invoke this rule. So you got to call us around your birthday, and you can only move to a plan of similar or lesser benefits. So if you have a plan N, you can't move up to more benefits, which would be a plan G. You could only go lateral or down. Again, some of this will vary by state. So let's say Nevada. Nevada just got the rule last year, and they are a 61-day window around your birthday. Idaho also got the rule last year. They are a 63-day window. Illinois is a weird state. They give you a 45-day window. I know. Why can nobody agree? But Illinois only lets you move if you're between 65 and 75. So if you're in your 80s, you're out of luck, unless you're healthy enough to move. If you're healthy enough to answer these health questions, and they change a lot from insurance company to insurance company, and sometimes from year to year, that's what we can help you. But if you have the big stuff, you have Parkinson's, you have COPD, you have the big stuff, nobody's going to allow you to change unless you live in one of these states, Maryland, Louisiana. Now, Missouri is a crazy state. That's based on the anniversary of your Medicare supplement policy. So go figure that out. And if you bought your plan last year on October the 1st, you have a window 30 days before your anniversary, 30 days after. You can move regardless of your health. So again, if you have a health condition or you're helping your parents, this is critical information. Washington State allows you year-round guaranteed issue as long as you go to a plan of equal or lesser value. Now, when states have this is why when people ask me, like, how do you feel about Washington? Not good, because this rule means that insurance companies can't protect their risk. So most companies don't file there. The prices aren't competitive. When you move from Washington to Montana, you're going to be like, wait, the prices are better, but the rules are less lenient if you're sick. So this is crazy different state to state. There are 4 states that year-round you can change your plan. New York, and nobody's shocked by that. New York also has Medicare supplement rates that are double any other state in the nation. Double. If you live in New York and you're going to retire out of New York, you are in for a big and happy surprise. Your prices are going to come down. Connecticut, same thing. Maine is weird, but we all know that if you've been to Maine. Maine only allows you to do that in the month of June. So if you call me in Maine, I'm going to tell you, call me back in June. Vermont allows you to do it, but only with 2 insurance companies, Mutual of Omaha and United Healthcare. Of course, there's a long story behind that. Not going into that here. Just understand that the birthday rule that started in California and Oregon, and most of these liberal rules start there and slowly sweep across the country. And then we've added a bunch of states, and they all tweak it and do it slightly different. So it's really critical if you are on a Medicare supplement, you've already decided you do not want to go to Medicare Advantage for whatever reason, and you just want another Medicare supplement plan, But can we get you a cheaper price? Maybe. Almost always, if you've had your plan for 2 to 3 years and you're healthy, almost always we can find you something new that's at a lower price than what you bought 2 years ago, because you can answer the health questions. But if you're not healthy, that's when we need to know what state you're in and when your birthday is, or in Missouri, when you bought your last plan, so we can use these rules to try to get you another plan of the same benefits at a lower price, or maybe a plan N at a lower price. Thanks for watching. Hope you learned something. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.